I'm Jude Hayward. I'm a GP and I've worked in Bradford for a number of years. I've also worked in clinical genetics for a number of years as well. I don't really remember when my genomics journey started. I've always been interested in genetics and genomics and inherited conditions. I think probably because it just fascinates me how personal it is to people when something runs in the family, what it means for them and for their identity. So really, I became interested in family history right from the beginning, very soon after I qualified as a GP. And I think that's a really key point to make is that most people in general practice don't realize that they've been doing genomics for a very long time. For a very long time in primary care, we have been identifying people through family histories who may have a higher risk of developing certain conditions such as cancer, or who may have a condition running in the family and need support when they're thinking about how to have a family, or they may have symptoms themselves of a particular condition. And really, our role in primary care has always been to talk to people, ask them about the family, and then facilitate onward referral if that is something, if they are somebody or their family who may benefit from onward referral to clinical genetics. So I was really fortunate about 20 years ago, an opportunity came up to train within clinical genetics and become what was called then a GP with a special interest, a GPSI. And I've been working in clinical genetics ever since, helping to care for patients who have got a family history of cancer, who may be eligible for genetic testing for an inherited cancer predisposition, and certain conditions such as neurofibromatosis type 1. And as I said, really quite early in my journey, I became aware that most colleagues in primary care aren't aware that they've been doing genomics for a very long time. And so I started doing some educational sessions, I started teaching, and people asked more and more for for me to write things and to deliver events. Because I really sort of translated it into cases that they see in their everyday practice. And really, that's grown and grown. And over the years, I have now worked for the NHS England Genomics Education Programme as their primary care lead for a number of years. Again, continuing to just help colleagues to become aware of when genomics does present in their practice, help support them with the knowledge that they absolutely need in order to deliver care to their patients, but also to strip it back and remove any complexity that they don't need in order to deliver that care. So I really can't pass up an opportunity to talk about the resource that we've been developing for a number of years in the genomics education programme called Genotes. There is a primary care suite of resources. It is based on patients, on real clinical scenarios. They are very brief. They've been written by GPs for primary care. And we've had really good feedback about how concise and useful they are. So if you have a minute this week when you're having your cup of tea, or if you do manage to grab a cup of tea in primary care, have a look at Genotes, and you will see patients there. You will see patients within those scenarios that you see every day in your surgeries. Over the years, I then had the chance to go through the Masters in Genomic Medicine when I realised that things were changing at a rapid pace. Genomics was taking over, there were more technologies, it was going to be able to contribute to more areas of clinical care. So I went through the Masters in Genomic Medicine. And again, through that, realised that there were a lot of primary care colleagues who were doing similar and weren't really sure how to take that forward or continue their learning or use their expertise afterwards. So since then, I've moved more into innovation, and this has just really enabled me to carry on the journey, discovering more about genomics, which is important for primary care. And really, the areas of big impact that are coming to us in primary care are the use of genomics in prescribing to help us ensure that we are prescribing the right medication for our patients at the right dose. And hot on its heels also is the field of integrated risk scores. So using information about genomics to help predict risk for certain chronic conditions such as cardiovascular disease. So genomics is here. We are using it in primary care. We have been using it for years. And really, we will just continue to do what we've always done. We will talk to people about their family history. We will identify symptoms, and we will talk to people about risk of particular conditions. And increasingly, we will start to use it in prescribing decisions as well. So I hope I've inspired you today. It really is here. Please go and have a look at Genotes, and you will see patients that you see every day in your surgery. Thank you.